this point.
You sure it's a good one?
Okay. watching it on screen as well?
No.
Okay. Okey doke. All set? All right, it just turned 1 o'clock. I would like to ask Etta to come up and lead us in prayer. This is an Office of Insurance Regulation quarterly meeting, so it's a little different than our normal resident chat. There's specific things that the Office of Insurance Regulation requires us to go over. One is quarterly financials, and then one of the other items is the quarterly board meeting to give an update on what happened in the board. So those are the two primary things that are covered in OIR. So we'll go through that agenda, but first we'll start with prayer.
Dear Heavenly Father, we thank you for this opportunity for us to gather together as a family. Here we come today to discuss the business of the mission and vision that you have called us to. Help us ever to be mindful that it is our hands and our hearts that you use to reflect your love to the world. Now, God, guide us in our community. Help us to be that light that shines. Help us to be that city that sits on a hill. Help us to be the candle that cannot be hid under a bushel, but that it shines love for everyone and welcomes everyone into this community, a community where we love you and we work under your care. Now guide our thoughts and our deliberations today. In Christ's name we pray. Amen.
Amen. Thank you, Etta. Can everyone hear me okay? All right, good. Okay, good, thank you. So we're going to use the lapel mic here. I've been told that it works better for me because I move around too much, apparently. So hopefully this will work. If any point people have a problem hearing me, let me know. Just raise your hand, or if you're on the phone, please let me know, and I'll hopefully be able to address that. So the agenda that we have for today, as I was saying, is Office of Insurance Regulation agenda. We go through my report, which will cover the April board meeting, a construction update on assisted living and Lake County, dining room update on construction there, update on where we're at with strategic planning, and then I'm going to cover staffing and occupancy items that have come up. And then David will give the year-to-date financial report, so he'll cover the first quarter of the fiscal year. Our fiscal year runs on a calendar year. So David will give that report, same report that he gives to the Finance Committee and to the board. And then Maria and I will go through an update on COVID, any new information or anything that's happening. Today I'll also be sending out the residential living and independent living update. The written update will go out today as well. And we will get the administrator's report from Maria, which is assisted living in Porter McGrath. She covers both areas. And then we're going to ask Etta to update on where we're at. She's been out visiting some places relative to the Community Impact Program. And then we'll have Samantha, our new Life Enrichment Director, will come out and talk about some of the events and programs that are going on through Life Enrichment. And then at the end, if there's questions, comments, for those of you who are on the phone, if you have a question at any point in time, please take your phone off of mute. If you are on the phone, please put your phone on mute, which is *6*6. And then whenever you have a question or comment, just take yourself off of mute and go ahead and ask your question or make your comment. So this is being televised on YouTube as well as on channel 733, and it looks like all systems are functioning, so that's a good thing. So hopefully we'll be able to address any thoughts, questions, or concerns that you all have. So in the executive director report, the board met in April in part of their quarterly board meeting. They go through their consent agenda, which is basically the meeting minutes from the previous meeting, the quality of care, governance, finance, strategic planning minutes, the Loving Care Fund report, and the administrator, Maria's dashboard report. We then go through each of the different board committees, which are quality of care. In quality of care, we provided an update on COVID-19 on the campus. Very familiar to you guys. It's what you're getting on a weekly basis from Maria and/or myself. It's that update that we provide you guys. They're also getting that update. Porter McGrath update. Maria gives an overview on some of the things that are happening at Porter McGrath. And then Alexis gave an update on what's going on with new programming with Life Enrichment. Then in the governance committee, we talked about a program called Board Effect, which is a web-based program for board members to gather information and for us to load that system so it makes it easy for board members to review and gather information and stay organized. So we're implementing that system. Starting in the next month, we're starting to put that program into place and set it up for the board. There's a bylaws and governance task force that the board has as part of their governance committee. The first project that they have that they've started is redefining our bylaws. They're in our bylaws, they are out of date. So when I look at the bylaws, I see things like that there'll be a representative from the Synod on the board. And that hasn't been done here in years, hasn't been a practice. So I had to look up and try to find what is the relationship with the Synod, because I was hearing different things from different people. So eventually, Janine brought to me the covenant with the Synod from the Presbyterian Church. And the Synod document that's signed by the Synod representative and my predecessor, John Hayne, was saying that in the covenant, there is not a membership responsibility from the Synod on the board. It is a relationship that is more informal. It's not, they don't own us, they don't have a legal right to the organization, and they don't have a legal obligation to the organization. That's pretty normal in our field. When I worked in Madison, Wisconsin, we were a Lutheran organization, and in the Synod arrangement with the Lutheran Church, and it was both Missouri Synod and ELCA. So it covered both of the primary groups in the Lutheran Church in America. And the issues that we had that changed the relationship was we were seeing all across the country that if there was a problem with the church's financials, people would go after the retirement community's funds. And if there were problems with the retirement community, people would go after the Synod and would go after the church. They would follow the money, right? So that was happening all across our field, that was an issue. And so what we saw was organizations like ours doing what we did and working with the Synod to say, to protect you and to protect us, we're not going to have that legal structure of ownership any longer. And so our bylaws don't match that covenant. So we've got to clean up the bylaws. So that's what we're working on right now, is going through and cleaning up the bylaws. The other projects that we'll be working on with governance through the remainder of the year is governance policies. Some of the governance policies haven't been updated in years, and they refer to positions that don't exist here any longer. So there's things that we're going to be doing there. The other thing we talked about was board diversity. And as a board, looking at, as we start our recruitment process each year, we usually are recruiting in the fall. And so in the process, what we do is we do a gaps analysis where we look at the board makeup and we say, how many are male, how many are female, how many are this ethnic group, what are the different ethnic groups represented? What are the different professional skills represented? Are we missing any skill sets that we should have on the board that we just don't have? We look at experience and backgrounds of the board members, and then we identify where we have gaps. And what we're doing with diversity this year is focusing on identifying the gaps, and then when we go out and recruit, spread the net a little wider and look beyond just our normal friends that we know, from the community, and try to extend the outreach a little bit more to see if we can attract people that meet certain needs of the organization, like, say, a professional gap. Let's say we needed somebody that had a clergy background, and that's how we got Paul, was because we recognized when Marilyn Cummings left the organization, we had a gap in the board of not having somebody representing clergy that can help us weigh decisions that we're making with that prism. And so that's what we're looking at, and just spreading the net a little bit wider than just the base of people that we all know through our relationships. So that's what our focus is with governance. In terms of motions that went through the board, there was a motion made to accept the strategic planning process. It was made by the planning committee to the board. There was a well-defined outline of what our strategic planning process is. It was reviewed by planning and approved by the board. So we're initiating that planning process, and I'll talk a little bit more about that in a couple minutes. In finance, the finance committee report, David reported that the audit has been completed. We shared the audit draft with the board. The finance committee of the board motioned to the board to accept and approve the audit. David can talk about the audit, and there was, I won't steal his thunder, but it was a good, clean audit, so he'll share more data on that, more information. So that was approved. And then Alexis did a presentation on our, from Data Tech that was presented to the Finance Committee, whether or not we should go to the cloud and do all of our saving of documentation and information in the cloud, or should we continue saving it on servers? And David did a cost analysis comparing the cloud versus ongoing servers. The problem we have today is 2 of the servers are, I think, at about 7 years of age, and those servers are no longer covered by the company to support those servers. So that's an issue. If something happened to the server, we wouldn't be able to get that addressed by the company that provided the server. It's become obsolete. They no longer support that server. So we need to get 2 new servers to replace those servers. So the recommendation from Alexis and David and the review with our board member was involved as well, Tom Bowles, who is, he owns and operates a tech company, a tech management and solutions company. The unanimous focus was to go forward and replace the 2 servers and remain on premise with our data storage. So those things were the only motions that were made at the board meeting. David reviewed the year-to-date financials, which you're about to see after I finish the presentation here. And then Martha Pope gives an update from the resident council. Martha reports from resident council on things going on with residents. Then Maria gives the administrator's report, and then I give the executive director's report, which is basically just some of the things that are happening in the organization and answering questions. That was about it. That's the April board meeting. Those are the items that went for motion, and that was the subject and focus. Any questions on the board meeting? Please.
I don't know the question, but I wondered, years ago, we were aware of people that are on the board. Now, you mentioned at least 3 people that I'm not
Right.
familiar with at all. I'm
Yeah.
wondering if the residents get a copy of the board membership.
We can send something. Yeah, Oh, I'm sorry. The question was, the statement was that the residents used to get a copy of the names of the board members. We can send that to you. The photos are right in the entranceway in Port of McGrath. So there's all the photos of the new board members and all the board members. They are. Yeah, they are. But we can send it. In fact, what I'll do is I'll send it when I do the update today. I'll list the board members. Yeah. Hopefully, we're going to be able to get back to a place where the board members come for lunch before the board meeting, because they really appreciated having the opportunity to sit with residents and talk with residents, and residents to get to know them as well. So hopefully by the time our next board meeting is in July, we'll be in a position to do that. And I think that would be a good thing. So thank you. Any other comments, questions relative to the board meeting? Okay. If not, I'll go on to AL Construction. These are the 5 units that are right down in Howland Delay, the first floor of Howland Delay. Right now, we're ordering the furniture. We're waiting on the furniture, and we're waiting on artwork. Cabling through Spectrum. We're still waiting for Spectrum to schedule a day to come in and do the cabling to set up the TV and internet service down there. But everything, there were 42 items on the punch list, and I understand that 40 have been completed. So we're just waiting for these last few items, and hopefully we'll announce an open house. We've had I think about 15 residents that have signed up for the open house to see the new space, the renovated space. So hopefully that will get going here. We'll get we'll get the certificate of occupancy, which is the last piece from the city. Once everything is done, they come through and do an inspection, and then hopefully we'll get the certificate of occupancy. 33 Lake Hunter is moving. They're working over there. You're seeing the project. I want to speak to, I see you both kind of giggling. I know it. So what was delaying all this? There were delays from getting windows shipped to us. There were a lot of delays in the timing of getting the lumber. Lumber is becoming a big issue and problem in construction right now due to COVID, from what we understand. Supplies are having problems getting the supplies from China and different places, Canada, to us. And so there were a lot of delays with that. There was delays with getting scheduled with the city for certifications that needed to occur. There was delay with cement work to set the foundation. But since they've been able to get under roof, it's moving. We're seeing it done, and they're telling us in 3 weeks we should get the CO, and that's what they're telling us. So hopefully we'll get the certificate of occupancy in about 3 weeks so we can move the resident in there and he can enjoy being part of the community. Dining room update. If you walk past the dining room now, you'll see that where the buffets used to be, they've been moved. And so they're all in process, and it's scheduled to open the first week in June is when it's scheduled to open. Our target is to open around June 1st is the target for when all the construction should be complete. And I want to just go through quickly, and we've done this a few times, but I don't think it's a bad idea to just continually remind people of what the dining program is going to be in the new renovation. So we're moving away from buffet style. That's gone away. What we're doing is we're taking the hot buffet and we're moving the hot buffet closer to the doorway into the kitchen. And we've taken out that wall, that narrow wall that had the sign, the Florida Presbyterian Home sign on it that covered the door. That wall's now gone. That will be where we put the buffet setup, and that'll be encased with a glass front. So you can go up and you could see the different items, but you just can't reach in and grab items. So that's the key difference. The other key difference is where the ice cream machine is, there's a half wall there now that encloses where the ice cream machine is. And that buffet we used to put the desserts on is behind that wall. So now we're going to waiter-waitress service for lunch and dinner. In breakfast, if we have our normal numbers for breakfast, it's usually pretty low. We don't get more than 10 people unless it's the men's group. We don't get, or the teachers or different groups that come in. We usually don't get a whole lot of people for breakfast. So what we're going to do with breakfast is have where you come up and say, I want 2 links of sausage, I want 2 pieces of bacon, I want eggs, and they'll plate it and then hand it to you. But because lunch has a greater volume, many more people eat lunch here than they do breakfast, we got to go to waiter-waitress style. And dinner will likely be waiter-waitress style as well. So you can pre-order, or you could sit down and look at the menu and then say, I would like this, this, and this, and the waiter or waitress will bring you, your drinks, your salad, your soup, your entree, your vegetables, your starch, and your desserts. So it'll be more of a restaurant style at that point. Please.
Are you thinking about reservations also?
Yes. Yeah, good question. The big things that I can't answer because I don't know right now are, can the folks from Porter McGrath and Assisted Living come down the day it opens and use the dining room? It just depends on, from a health standpoint, what we're hearing from the county and what we're hearing from our epidemiologist and where we're at that point. So until we know and we have a better sense and direction around that, initially what I've asked of Dean is in the first week, do a test run, and just have just a small group of assigned people that say, I'd like to be in the test run, and give our staff about 1 week to get the kinks out. To go from cafeteria style, where you're serving yourself, buffet style, to waiter-waitress style is a big jump. And we want to make sure that the cooks and the dietary aides are trained and are ready to go. So we'll have the first week will probably be a pretty small test run. It won't be completely open at that point. We just want to make sure everything's working and that we've got this service down. Okay. One of the different positions, new positions that this adds, is bus service. Bus boy, bus girl, who would bus the tables. So wait staff will do some of it, but we'll also, during lunch when it's crowded, have a bus person bussing tables, which we haven't had to have in the past because of the way we were set up. So that's the dining room update. And again, we're shooting for June 1 as an opening day. Strategic planning effort, I alluded to this in the board report. We are undergoing a pretty extensive, be about a 4-month process in strategic planning. We have, the board has identified 5 strategic areas of focus: resident quality of life, employee satisfaction, community impact, clinical excellence, and financial stewardship and sustainability. And under each of those 5, the board has identified goals for each of those 5. And so under those goals, we're creating action teams. And those action teams will be led by a member of the management team, and they will facilitate a process with the action teams to create a plan of action for each of the goals. And so in those action teams, we're recruiting residents, we're recruiting staff, board members, people from the broader community who have an expertise in a certain area that could be helpful to us. As an example, like where we have a team that's focusing on the clinical excellence and financial sustainability of Porter McGrath, we're asking for our medical director and asking for the hospital to provide representation on that task force to help us develop our plan. So that's was approved by the board. The next step is Janine and I are working right now in creating a binder of information, and we'll do a workshop for the team leaders who are all managers. Those are the team leaders And we'll do a workshop to train the managers on how to facilitate the planning process. And then once they've gone through their training, we'll start recruiting our teams. We've presented ideas and names to Martha and to Bob and have asked for input on representation from the residents in those action teams. So we're moving forward, working with the resident council to identify the residents to be on the action teams. If it's something you're interested in, let me know. I've had a few residents come to me over the past 2 years saying, you know, if you ever do this on planning, let me know, I'd like to be involved. So we're moving that forward. Staffing, the challenges that we've had, 2 updates ago, I sent out an infographic that our organization Leading Age provided that talked about the challenges of recruiting and retaining staff in our field. It's not something that's unique to here. This is something that's occurring worldwide. The challenge as the aging population goes up, the number of older adults rising significantly, driven by the boomers primarily, and the number of people who are employed to provide care for them is actually in decline. So it's been in decline. When COVID struck, it expedited that challenge significantly, because what was starting to happen was you had nurses saying, you know what, if I go and work as a travel nurse, I can make a lot more money as a travel nurse or as an agency nurse than working in the hospital or working in a retirement community. So we started to see some people transition into those roles. The other thing we also started to see in our field is people who were in their mid to late 50s in these leadership roles going, I don't want to go through this. This is not something I want to end my career in a situation like COVID. So we saw retirement for these key positions go up significantly during this past year. So you match all those things up and it creates a significant crisis around staffing. The other piece that drives that is the fact that how do we get to a $15 minimum wage? Because that's where we're competing. When we look at Amazon, Amazon is building the largest distribution site in the Southeast at Lake Linder. They're offering $15 minimum wage. So we've had people who've left here to go there to work. The city of Lakeland, in their grounds crew, pays $15 to $16 an hour minimum. So we've had people from our grounds crew move over to the city of Lakeland. So the competitive nature is becoming more and more significant. Kim was just sharing before this meeting that one of our competitors is at $12 an hour for housekeeping. And that's a jump. We're at our $10 is our minimum. Minimum wage at a federal level is, I think, $7.50. We're at $10 minimum wage. We moved to that 2 years ago, 2.5 years ago, and now we're seeing it just being jumped right over the 10 to 12 and 15. So we've got to figure out a way to be able to get us to 15 in the next 4 or 5 years was the plan, by doing $1 a year. But the challenge is the providers are all having to move in that direction faster because Walmart, others are moving in that direction. And so that's who we're competing with. If somebody's looking at, do I want to be a CNA or do I want to work, at Amazon or at Walmart, the work is a lot different, to be a CNA, the type of work that it is compared to, working at Walmart or at Amazon. So those are things that right now are a challenge for our entire industry. And what you see Walk-In Wednesday, the signs and the job fairs, those have been effective. We recently recruited a director of nursing through our Walk-In Wednesday program. So we are able to have people come in when they see those signs, and Kim promotes that out in the webosphere, I call it. She promotes it out in Indeed and different places. And it's working, but it's the labor pool And I know you guys are reading this in the paper too. The labor pool is not moving a whole lot. You see restaurants everywhere you go. We're hiring, we're hiring. It's become a major challenge. So that's one of the things we're focusing on, and how do we manage that going forward. Did the system shut down? Okay. Oh, okay. Occupancy, we have about 11 open apartments. Cher has 2 interested people that she's working with on those apartments. We've got 4 houses, and 2 are under contract, and the other 2 are pretty close to going under contract. Was it just that the screen timed out? Oh, good. All right, good. All right, that's a good thing. Okay. And then in assisted living, we have 6 open units in assisted living, counting the 5 as part of that. So we've got openings in assisted living as well. Any questions on the executive director report, any of the items that I covered? Okay. Anyone on the phone, any comments? Debbie?
A question about the 9 open apartments.
11.
Are they studios or 1-bedroom?
Good question. It's a mix. It's mostly the studios and 1-bedrooms. It's not the larger ones.
Yeah.
So one of the things that I've asked Cher is to identify where are the ones that are right next to each other. The problem is we only have like 64 apartments, and so that takes out an entry fee. And if I had 100 or 200 or 300 like Carpenter's has, I can look and say, well, we can combine a bunch of these, and yeah, the entry fee, we lose a full entry fee, but I've got all this inventory, I'm okay. Here, because we only have 64 apartments, we've got to be pretty thoughtful and look at it with David and say, okay, from a financial perspective, it's not like we can combine 2 units and give a double entry fee. So it's like, what financially works? Is something better than nothing? Yeah. So that's what we got to evaluate. The other piece that we have to evaluate is looking at the monthly fees and looking at the operating impact of doing that on monthly fees, kind of managing all that, because it would lower our cash flow if we do that. So it's not something we could just do across the board. The other thing we're looking at with the open apartments is rental, and just doing for apartments that we have been on the market for, say, more than a year, looking at a rental model. Now, if a person is saying, okay, I'm going to rent an apartment in independent living, let's say in Fort Bunker, they would be paying a higher monthly fee. They wouldn't have the big entry fee, but they wouldn't have the commitment to life care through the remainder of their life. It would be just for that apartment. So they couldn't just, have a life care contract without the entry fee. So that's something we are looking at as well.
Well, but it will be interesting to find out what boomers want
Right.
in their housing.
And there's a lot of good articles out there. I'll see if I can find them and send them to you. But this was big, like 3 or 4 years ago, about what do the boomers want. Yeah. And there was all this research done. Was it entry fee? Was it rental? What was it? And back then, it was a mix. There wasn't like a clear-cut directive that the boomers don't want to pay a lot of money down. We all thought that's what was going to be the case, that the boomers would say, why would I gift all my money? And that wasn't what they found. It was kind of a mix. So I'll see if I can find that article. Any other questions or comments? Anyone on the phone that has any questions or comments? Okay. Okay, if not, I'll wait another second. Okay, if not, I'm going to ask David to come up, and David will do the financial update. I'll put this on for you. Yeah. Okay, that's on for you. That's a,
On. Hello? 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 There we go.
let me grab this one. Thanks. Trade you. Whoop, you got runaway.
Check, check. Okay, here we go. As Joe was commenting, want to make a couple of notes. He was commenting about the audit. I normally don't like to, boast on the team, but, accountants were kind of introverts and like to stay in their offices. But this is the third year with our audit team, CLA, Clifton Larson Allen. And they did say in open board meeting that this was the cleanest audit they've had since they've been here. Normally, unqualified opinion. We had one audit entry, and I think the first year that we were here, I'll recall, I think around a dozen entries, maybe a little bit more. And normally you'll have 2 or 3. And the one that we had was known. We were waiting on the bank to give us a calculation on our swap. And it's just a entry that we have to make. It's according to GAAP. It really doesn't affect the financials, except there is a number on the page. And the number we did get from them came in November, and of course, being a calendar year, we have to have December, and that was the entry. There were no management comments. There's no governance comments. It was literally about as clean of audit as I've ever had in my career. So that's compliments to my team. And, the audit was done completely remotely, which I kind of like, because you don't have auditors, breathing down your throat, just a lot of emails. But it was, the process went really well, and we liked their process, and it's mostly online, like I said, and it was, got done in time, and as some of you may know, the audit just triggers a whole bunch of other stuff that we're fast and furiously working on right now. Joe also mentioned about the IT solution that we're considering. What he didn't mention was when we were figuring out the 2 choices, the cloud versus the on-premises solution, there's about a $100,000 difference, and that was the deciding factor of let's stay on premises. So evaluate, everyone's going to cloud now, but it was hard to justify $100,000 just to go to cloud. So we decided not to do that. The financial report, this is just for the first quarter of 2021. Let me make sure this is on and working. Yes, it is. Okay. Let me get out of the way. Go over here. I might be out of view, but just some quick slides. These are pretty much the same kind of slides that we've offered before in review. I'd like to look at the covenants and then just a brief overview of our balance sheet position, income statement, and cash flow. But one of the things I like to do here is just show a trending. Instead of just showing a number on a page, how have we performed over time? And I like to look at 2 or 3 periods. First and foremost that the board does pay attention to are the covenants we have with our bondholder. And the 2 covenants are the debt service coverage ratio, which is essentially of all the income that's generated in the company, how many times can we pay the debt back for a year? And as you can see, from September of last year until March of this year, the number has increased quite a bit. That's a large part in due to the government funding that we've gotten, the PPP funds, the HHS funds, We did get a sizable donation to the Love and Care Fund just a little while ago, about a little bit over $600,000. But those government funds and the increase in our investments have been a large part of why this ratio has been increasing. And going from a 1.6 to a 4.0 is pretty significant. The minimum that we have to meet is 1.25. So it's, like I said, the government funds, we had a PPP loan that we talked about a while back, which we received almost 1.4 million. And HHS monies, which essentially from Medicare, the government, was another 800,000. And then we had a contribution a little bit close to 600,000 just recently. So roughly about $3 to $4 million just in non-systemic and non-reoccurring type revenues, which went to go and impact this. And the debt to net assets ratio, that's just calculated by essentially the net equity of the company divided by the entire debt of the company. And as long as that ratio is below 1.25, then you're doing good. So the equity, there's more equity than there is debt, essentially. We aren't underwater. If we're underwater, it'd be over 1, as the number would be. But if we're above water, then it'd be under 1. And you can see that number is declining, which is good. So you want the debt to net assets ratio to decline, and you want the debt to service coverage ratio to increase. That shows a healthier operation. This is a synopsis of the balance sheet. And you can see that I have in here March 2021, just recently closed as compared to this time last year, March of 2020. And then that's actually unaudited. We got the audit just days after I was able to prepare this report, so I didn't have enough time to update it for the audit, but it didn't really change other than that one entry that I was talking about with the swap. But what's interesting here is comparing from a year ago, March to March, the assets have increased nearly $6 million. And like I said, you know, the capital gains, the non-systemic stuff. So we had some nice recovery in the market. That was about $2 million. The government funding that we received from the PPP and the HHS funds was another $2 million, and a donation of $600,000 is roughly about $4 to $5 million there alone. Excuse me. Just in non-reoccurring that increased the assets. Excuse me. The rest was reoccurring, which is our operations. Current liabilities, they did go up, but part of the accounting for the government monies was to show it as a current liability. Well, we since have been forgiven for that PPP fund loan. We got that notice, I think it was January. Since it's a non-reoccurring or it's a non-operating, that'll what I like to call below the line, because what we like to manage the operation on is census and operating expenses and revenues that we can control. So we will be recording that as an income item. It'll be under the non-reoccurring side, or what I call below the line, but that will be recorded this year for this year's financial. But essentially the main thrust is we've had a nice recovery in the market. We've had some fund injections from the government and a nice donation that has bolstered the asset side. The operating profit loss, red is a loss, black is a profit. And it's essentially broken down between two pieces, what I say, the operating side, or above the line, or the non-operating, which is below the line. The upper half, and here again it's comparing March of this year to March of last year, this time last year. And then the 12 months of 2020. But, so comparing March of this year, we're actually at an operating margin loss. That's that middle line, 127, I'm blocked by the mic. That's where we are. And this time last year, we were at 182. And, you know, it's beaten a demon to the ground, but it's COVID. Our census is down dramatically. It's down nearly 25% in the health center compared to last year. Last year, we were running around 58 patients in the health center. Now we're at 43 and trying to hold. And it's, you know, census is down 25%. Revenues are down about, I want to say, half of that, 14%. Spending is down only 7%. So it's, as Joe was talking about with wages, and that's causing an incredible pressure in trying to figure out how to manage the wage of the line staff, who are now being at $9, $10, $11 an hour, and we're being pressured with almost everyone and their brother looking for staff, and they're paying at much higher rate. How do we keep them and keep them here and wanting to do what we need them to do, and do it at a operational cost that we can afford, and matching with the revenues. And so right now, this is the full impact of what challenges that we're facing. A swing of 182,000 this time last year, and that was right before COVID hit. If you recall, the shutdown came in April, May. I remember sitting down when my wife and I bought our house. We were sitting down at the closing table in the middle of May, and the agent came in and said, the governor just sent the order, the state is shut down. So we were able to close the house right that day. It marked the day. But still, the full impact of that hit in April, May, right before March. So we had some really good census up to that point. And ever since that time, it's been a challenge to keep that census up and have a decent census to be able to cover the expenses. You know, the margins are thin, so we're watching everything we can and trying to take advantage of everything we can and trying to manage everything we can. One thing, let me see if I have this on the slide. Oh yeah, I'll get there, okay. Let me actually jump there. I'll go back to the cash flow statement in a minute, but one thing that is nice is even though the revenues are down, the census is down, our spending is down. Even though it's down only 7%, but that 7% impact is showing December 20, from 2019, the year that Joe and I got here, we were spending on average almost $40,000 a day, $39,667. And that's everything, insurance, real estate taxes, interest, wages, benefits, everything thrown in there. A year later, we dropped that number nearly $2,000 a day. So you think, and that's per calendar day. So if you're looking at $2,000 times 365 days, that's how much savings and cost that we had. And here from just these 3 months, our average has dropped another almost 3,600. Yeah, 3,600. So as census is dropping, we are essentially tracking with census. So the spending is less, it's just that the revenues are less also. So it's not like the revenues are staying steady and the expenses are going down, we're having a larger margin. We have still a finer margin, but both the revenues and expenses are dropping. We go back to cash flow. What's nice about this report is even though operations are challenged, census is challenged, staffing is challenged, regulatory reporting is challenged, we are still have a positive cash margin on the operations. So this $1,131,000 is generating from operations. We're able to pay for property and equipment. The net change in limited assets essentially is the change in gains or losses in their investment accounts. So that will it's shown on the cash flow statement, but it's effectively a non-cash item. Then we paid down some debt. There wasn't proceeds from debt, but that's essentially paying on the note for the bus. But at least, even though if operations are operating at a loss, on the controllable side, the revenues and expenses, the operations are cash flowing positive, which you want that, of course. So I touched on the spending is down. Our days cash on hand are up. So it'd be quite a different story if we were having a challenge in the operations and our cash was next to zero. But as you can see from a year ago, our cash went from 2.2 to 4.8. So we have a margin. We have time to wade this out. You know, the outlook is challenged. It's cautious, but we have reserves that we aren't in trouble. I guess is the best way to put it. We have time to work through this season. Fortunately, the government has helped us some, and we'll be able to use those monies to help tide the way. But you know, with the market recovery and the government funds and what we've been able to do so far, it gives us time. So that's my report.
Questions for David?
Oh, any questions?
Anyone on the phone with questions? Okay, thanks, David. Thank you. So Maria and I are going to give an update on COVID and just kind of a quick review. For the residents in residential living and independent living, you'll get the written update just in a few hours. I'll be drafting that and sending that out to you. There's no major changes in terms of protocols that you'll see in the update. We're hoping that by this time next month, we'll be able to have a full crowd into the resident chat and into these types of meetings going forward. But otherwise, there's no major changes that you'll be seeing in that update. Maria?
Good afternoon, everyone. So COVID, our positivity rates has been going, down then up, depending on our holiday seasons. So during the Thanksgiving and Christmas season, we saw a big spike over 10%, then it went finally back down under 10% in February, and it spiked back up after the spring break season. So it has been going back down, and it is currently at 8.42, and I'm going by the Agency for Healthcare Administration and their numbers that they put out every Monday for skilled nursing facilities. And at 8.42, it has to stay under 10% for 2 weeks before our employees go back down to once a week testing. The goal is to be under 5%. We have not hit that. And we have had some cases. We had a positive staff member on last Tuesday's testing. We had a positive staff member on Thursdays. So we tested twice a week. So last Tuesday we had a positive, but it comes back in 48 hours. So by Thursday morning we knew that the person that had tested on Tuesday was positive. There's a lot of variables that is still under research, and we don't know the reasons why. But these individuals were fully vaccinated. They're not symptomatic. They have no symptoms. We do have short-term rehab guests, and they're coming in with the vaccination cards, which is great. We still ask Lakeland Regional and other area hospitals to continue giving us a negative COVID upon admission. So we are receiving short-term rehab. That has not changed. We are not accepting any COVID positives. They are coming in with a negative COVID, and they're also giving us their copy of their immunization cards. Again, unfortunately, during outbreak testing, which means anytime we have a positive, we have to do outbreak testing of all residents and staff. Staff are already being tested, so that doesn't change. But we do test every resident and guest in the building of Porter McGrath. And during that outbreak testing, one of the short-term rehab guests did test positive. That came at the same time with our second positive staff member. So currently, we have 3 positive, 2 staff members and 1 short-term rehab guest. All 3 of them were fully vaccinated. We have Department of Health epidemiologists assigned to us. I have been speaking to them on a daily basis. Happened over the weekend when I got the results. I was on the phone with the epidemiologists. They have come out periodically. The last time the Department of Health was here to do an assessment was March 28th. They did come back out this morning because of the outbreak, and there's really not that many more recommendations that they can give us. We are following all our CDC guidelines, and they actually came back into the building to get another swab of this gentleman just to check for variants, okay? So they are checking for a variant, and since we are doing outbreak testing, one of the positives, and I can't say names, so one of the positive staff members that tested on Tuesday that tested positive, he had already tested on Thursday before getting his results, and the second one was negative. So it may be false positives, okay? Same thing happened with the short-term rehab guest. When we were doing outbreak testing, we had already collected the second specimen, and that second specimen came back this morning, and it's negative. So very likely that they're false positives, but it's on the hands of the Department of Health and the epidemiologists and the head epidemiologist of Polk County, Bernard, and they are looking into possible variants. Now, we also have had 8 clinics for vaccinations. We had the 3 original clinics from Walgreens, which offered the Pfizer. We had another 3 vaccination clinics through CDR Health, and that was also the Pfizer. And the last 2 are offering Moderna, and that is through our contracted pharmacy, Guardian Pharmacy. So they were out here last Friday, April 30th, to give the boosters for the Moderna, and they will continue to offer monthly clinics as long as we have people interested to get vaccinations. That is open for family members of residents, family members of board members, and also family members to the employees. We have heard all throughout the news not needing to be masked if you're fully vaccinated. And as the administrator for Porter McGrath and assisted living, what I'm asking is that anyone in the building visiting to Porter McGrath and assisted living to continue to wear a mask. All we need is one person that may be asymptomatic and it'll run like wildfire, and I don't want to, we don't want that. So we do have, we'll continue with the screening. We have the AccuShield machine that will ask you questions, and before it asks you the screening questions, we have put in the core as a reminder to wear a mask, keep social distance, and hand hygiene. Visitation was halted because of the positives. Once we did outbreak testing and we concluded that there is no additional positive cases, we were able to resume visitation today. Okay. Any questions so far on COVID? No? Okay, for Porter McGrath, just updates in assisted living and Porter McGrath is vacancies. That's what I have to report. We have 7 vacancies in long-term care unit. We are looking at our short-term rehab guests. If they need long-term care placements, then we're looking at it on a clinical point of view to see if they're not risk adverse, meaning if just to make sure that we can meet their needs. Some folks with dementia may have combative behavior, a tendency to wander very frequently or frequently falling. So if we're looking at it on the clinical and risk adverse to make sure that we can meet their needs, as long as we can meet their needs and then look at the financial aspect of it, do they have insurance, can they pay private pay, or are they Medicaid pending? We're looking at all those things because we've had, as you saw the presentation of David, we need the revenue, we need to build up occupancy. So we do have Katie Gannon, who I have mentioned in the past and have introduced her in these chat with Joe's, is our nurse liaison. She is able to go to Lakeland Regional on a case-by-case scenario. So if she has to lay eyes face-to-face to make sure that someone can be taken care of here, they are allowing her to go to Lakeland Regional on some situations, but Lakeland Regional has not opened their doors to nurse liaisons yet. Okay, but they have allowed her to go at least 3 times already. We also have hired this week, we have Danny Parrish, Danielle, she goes by Danny. She has taken on the role of the Assistant Director of Nursing. Stephanie Nelson is the Director of Nurses for Porter McGrath, and she has been working since she started in February without an assistant, without any unit managers. The challenge of staffing, she has put in not only her 80 hours in a pay period, but has also put in at least 5 shifts every pay period since she has started here, working anywhere from 3 to 11, 11 to 7. So we welcome Danny Parrish to be her right-hand person and help her with many things that we would need to follow through clinically. We also have hired Michelle Yeager, Yeager. She starts tomorrow, Thursday, and she has taken the role of our staff development infection preventionist. Okay, so 2 years ago, pre-COVID, they, meaning the government, CDC and Agency for Healthcare Administration, had put in regulation that every nursing home must have a dedicated infection preventionist. And we had trained someone under previous nurse management, and they are no longer with us. So I have been taking that role, and I'll be eager to pass that role over to Michelle when she starts on Thursday. Danny, the Assistant Director of Nurses, has 3 years experience in ER, emergency room. She also has background in long-term care. And Michelle Yeager, her background is also long-term care, but also as a Agency for Healthcare surveyor. So she has surveyed many buildings, and she doesn't have presently the certification for infection prevention, or let me take that back. She has the certification. She's never worked as an infection preventionist, but she surely has gone into buildings knowing what to look for, and will be able to train many of our nurses and get us prepared for the regulatory process and be tighter in that role. Any questions? No? Okay.
The only other thing I would add is I think occupancy was at 50 this morning.
Yes, we were at 50 yesterday. We had 2 discharges, but we're getting another 2 admissions, so we're trying to keep up into that 50 number.
Good.
So, yes.
Thank you. Yeah, I'd like to just speak a minute on Porter McGrath and assisted living. Maria, you know, what she's been able to manage through COVID, she's been the person that any of these protocols, I've gone to Maria and the clinical leadership team and said, does this make sense? Is this the safe thing? Is this the right thing to do? So she's taken on a lot of that responsibility with Pam and with now Stephanie and the clinical leadership team of really helping us figure out, you know, what's the best approach to minimize risk to residents and minimize risk to staff. So that's been something that she's had to pick up during this period. The other thing that I would share is that when you make a transition with a director of nursing, that's a huge change in an organization. When Cookie determined that she wanted to work closer to her daughter and assist with her daughter's new business, that shift and finding the right DON took time. And I commend Maria for not being, although she was in a rush, she wanted to get the position filled, she was patient to get the right one. And I think Stephanie Nelson has stepped in. And the fact that Stephanie, when somebody calls off or an agency doesn't show up, picks up a shift, is very different than where we were. You know, it speaks volumes for staff to see the person that they report to side by side covering a shift, you know, working a med cart, doing those things. That's not the best case scenario. That's not something we want for the long term. And we're glad, you know, with the addition of Danny and Michelle, that we can start to move away from that direction where they're having to pick up and doing so much. So that's all right.
And having said that, the challenge also has drifted into assisted living. So where in the history that I have been working here, and that's been a very long time, assisted living has really been very stable with their workforce, and that has been unstable also. I think that it's just nationwide, industry-wide, it's been a challenge. So Pam Herbert also has had to step in and cover. Right now, she had a one of her nurses had a family emergency, so she has covered yesterday. She's covering today, and just putting it out there. It's Nurses Week, so if you see a nurse, let them know.
Used to be if you see a nurse, hug a nurse, and now with this, we can't do that. So a nice word would be very much appreciated. Well, talk about staffing just quickly. That role is so important, more important than it's ever been in our field because of what's happening in the labor force, because of what's happening in healthcare. And so one of the things Kim has really stepped forward, she's the one that's doing all of the recruitment, these job fairs, these walk-in Wednesdays, these ad placements, these phone calls to follow up with candidates. We've determined that when, with Alexis leaving the organization to go to Orlando Health, we looked at our budget and we looked at, you know, what would be the highest best use, recognizing it's not, let's just fill the position. So we said a part-time recruiter right now, to me, is the most important thing we can add to our team. So we're not today recruiting for Alexis' position. I've picked up IT. I've picked up life enrichment. The good thing with life enrichment, Alexis put together a really strong team with Samantha Barrett, with Etta, with Allison, with Debbie, with Cheryl. That's a really strong team. On the IT side, we have a really good consultant vendor that we're working with. So we've been able to pick up some of the pieces. Maria has picked up the QA and the quality initiatives with her team and herself. So we've decided that those resources, we want a part of those resources, and the most important position that we see right now is recruiting. And so we're in the process right now of hiring person just to do recruitment. This is the only organization I've worked in that didn't have a person that was just focused on recruitment. And I think that's fine when you only have 2 or 3 open positions, which maybe in our past history we had very few positions that were open. But now we're averaging well over a dozen on any given point in time. And so we really need to have somebody who's solely focused on recruitment. And so that's the direction that we're going. I would like to ask Etta to come up, and Etta will give the life enrichment update for Samantha as well as for spiritual life. Thanks, Etta.
Just a few updates for the Life Enrichment team. For the months of May and June, we're going to do a lot of celebrating on campus. Maria already alluded to the fact that it is Nurses Week, and we'll be joining in and helping them celebrate the nurses in May, and then the CNA's time of celebration will come up in June. Also, we have events planned this week. There are Mother Day teas that are happening throughout the week and then culminating on Friday. And not to leave out the guys, in June we're going to have backyard brats for Father's Day, and we'll celebrate in Drain Park, and then for the health center we'll celebrate in the Helen Berry Garden. In the month of June, be on the lookout for information coming out for Alzheimer's Longest Day. We always do a bake sale for that day, and so we're planning on that again because twice a year we do a fundraiser for Alzheimer's. And June, for the Longest Day, happens to be one of the biggest ones that we do. So be on the lookout for that. You'll probably get some phone calls about what we need you to bake or make or to come and just support that as well. This Friday, Sykes Southern Barbecue will be on campus, and there have been advertisements in the Now Read This and in the Daily Scoop for you to go ahead and make your order. They will be parked in the therapy parking lot, which is our B parking lot. They'll be there from 11 to 2. And I know many of you have expressed how much you enjoy having them come out. And for the rest of the summer, we're looking at having food trucks come out each month. So you'll be hearing what those food trucks will be and what they will be sponsoring during those times. Some residents have expressed the desire to begin volunteering again in Porter McGrath and also in assisted living. We, as the Life Enrichment team, we just ask that you would check in with Samantha, our new Life Enrichment Director, and let her know what your availability as well as your abilities are, and she'll help match you with volunteer opportunities. There is an orientation and a training we'd like you to go through just for protocol and so that we can know what you're doing, when you're doing, and what residents you're working with. But please, if you were volunteering in the past and that's something you want to do, or if during this pandemic you have sat around and just come up with things you can just do to help be supportive, we'd be more than happy for you to join the team and go back to work. I know many of you are sitting shaking your heads because you were volunteering before. So if you feel that, just let her know. I did get an email yesterday, and I didn't get a chance to share this with Joe already, but I got an email from the hospital yesterday that chaplains are going to be allowed to come to visit in the hospital, but there's quite a few precautions that I have to do to register and get that done again. But hopefully by next week, I'll have everything situated with the hospital, and then I'll be able, as a chaplain, to go out. The nurse liaison is not allowed to go out, and the nurses are not allowed to go out. And in the past, Pam and the admissions team and myself, we would rotate on visits. But right now, it's only chaplains or pastors from your churches, and you can only have one visitor in the room, but the chaplain or the pastor does not count as the one. So I don't count as a person, but I can go. That's great news. I'm happy about that. So hopefully starting next week, as residents are in the hospital, I can go out and kind of help with that connection and communication, helping us to have a smooth transition when they come back to the facility, because I know that's one thing that residents have been missing as well as staff, that link in between so that we know where you are and what's going on, know that you have our prayers and any support that you need, but also helping you to transition back to the facility in a smooth way so that your anxiety level is not raised because of that. So that's good news that we're getting from there. On the community, first of all, any questions for life enrichment? Okay, on the community impact project, I've been busy on that as well. This is kind of an information gathering time for me because we still have the quarantine restrictions in some areas. We do have precautions that we're using. So we're not fully active in the volunteer area in our community. However, I've been visiting the things that you listed off of the survey that you were interested in. And two areas, I'll just give a brief synopsis on that, but I'm going to do a write-up in the Hunter Herald so you'll have more information as we're going forward. Many folks listed that they were interested in doing volunteer work at Florida Presbyterian Homes, in education, in social justice, elder causes, mercy ministries, environmental ministries, and medical ministry. And so I visited one mercy ministry, which is Blessings and Hope Food Pantry. And the goal is to visit ministries that are in our community, not just Florida Presbyterian Homes neighborhood, but in the Dixieland neighborhood, we're trying to stretch out. And this one is located on Edgewood. So they're literally 5 minutes away from us in driving. And I met with Pastor Alan Fredo, who is the head of that organization. They've been doing this for about 3 years. They do donations to the Lakeland community mostly, but most of it is our Dixieland residents and a little area out from there. They help feed 500 families on an average a week. And so I went on a Tuesday, which is one of their donation days. They do from 11 to 1. And I went just so I could see what the operation was all about. He gave me a full tour of the walkthrough. He's using an old Wells Fargo bank building, which the story behind that was that he needed a building, and where he was working was he outgrew, and he drove by the building, saw a for sale sign, called Wells Fargo. They set it up. They came and talked to him, and at the end of the interview, he told them he didn't have any money. And he thought, well, what was the interview all about? Well, Wells Fargo ended up giving him the building as a donation because of the work that he's doing in the Lakeland community, which I thought was fabulous. But they're feeding over 500 families. I did stay and volunteer. I was only supposed to be there about 30 minutes. I ended up staying 2 hours because I got so caught up in the work and just seeing what they're doing. And so I'm going to give you a detailed report, kind of in a synopsis in the Hunter Herald on the findings from there. The other organization was one that was under the medical category, and it's Lakeland Volunteers in Medicine, which many of you are already familiar with. They had several volunteer opportunities that they listed, but they said they have opportunities for you to volunteer from home as well as on site, which is something that was interesting to me, especially from at home. And so I'll be sharing with you just kind of what some of those are from there. From the survey, the residents said that there are 30% of you who are likely to lead in volunteering. I need to know who those 30% are, because what I'm going to do out of my office is I'm going to get teams together in different categories that residents have shown interest in and ask for a leader or two people to kind of co-lead to help me with that so that we have groups that are volunteering. So for instance, if there are residents who are interested in volunteering at Lakeland Volunteers in Medicine, I'm going to ask that there be a leader of that group, someone to just help coordinate who's volunteering and to kind of keep track of hours so that we can get those reported, so that that doesn't all fall on my desk, because you all know, being the chaplain for the community with 300 residents, there are a lot of other opportunities and things that I need to do, but I will be working with the leaders. But 30% of you said you'd be more than happy to lead, and I'm more than happy to know who you are. So please let me know on that. The good part about that is, don't feel like because you're a leader you're going to be alone, because 60% of the campus said that they're willing to serve on those committees as long as they don't have to lead them. So I just need 1 or 2 people to step up and lead, and you'll have 4 or 5 that will join your group, and we can go out and we can do the work. I'm going to do the background for you, find out the information, the opportunities. See, God is pleased. The light just came on. But it's going to be interesting, and I'm very excited about that. So we'll be doing that going along. Now, Joe is going to handle more of the advocate, the legislative part, But also, there are a few residents who have already said that they'll be willing to work with him as a team with that as well. So just make sure that we know who you are and what you'd like to do, and know that there's plenty of work to be done. And pretty soon, we'll be out there just beating at the hedges, getting it done. And I'm excited about it. Any questions for me on the community impact part of this, or any questions?
The only thing I would add to the spiritual life report is we had ordered a cross for the Memorial Garden. It arrived last week. I think it was last week. It's 14 feet tall, of which 4 feet will go into the ground, so it'll be 10 feet from the ground up. It's made of a wood called ipe wood. It's absolutely beautiful. So Etta and I met with Ryan Ellerby to finalize the hardscape plan for the Memorial Garden. He's going to draft that up, our final plan, and then we'll hire him and Ellerby to start the Memorial Garden project on the hardscape. And then we'll meet with Rick, and either it'll be Flora Lawn or Chad's Lawn that will work up a plan that's based off of the original plan that we had to start planting. Once the hardscape is done in the Memorial Garden, we'll start the planting. So the way that a project works best is that whether it's residents that have a thought or idea on a project, or it's a staff member that says we need to do this project, is for that to be presented as part of the capital budget process, because that way it gets vetted by management, it gets vetted by the board, and then once there's a commitment to support a capital budget project, it gets done because you've got all the support of management and the board behind it. When projects just come up out of the blue, it's harder because we need to have more detail, we need to have all the information. We're working on other projects and working on other things, and then all of a sudden this comes in, and we've got to figure out how do we devote time and where do we manage to be able to pick up projects that weren't in the plan. So that's the best approach. I've had a discussion with Dick Huggins today looking at the property along Lakeside and looking at, we have a landscape plan for Bunker, but we're going to start the painting first. We don't want to do a landscape and then have painters with scaffolding and all that stuff going all over the landscape. So those plans are in place. And talked with Martha, was it yesterday, about creating a committee of residents. What we used to have on every campus, we had either it was called landscape committee, grounds committee, or gardens committee. And the role that they had was twofold. One, we would be able to bounce ideas off of them and say, here's what we're looking at for this landscape plan. Could you give us your thoughts and opinion? The other thing is if they saw things that needed to be done, they would present it to management that, hey, we saw this over here, we think this is a project we need to look at, and it would become part of the capital budget process. And so we'd be able to evaluate and look at it as part of the capital budget process. And so Martha's has talked with some folks about setting up that type of committee. And Donna Jones is moving forward with the plan, and Debbie and a team is looking at the Helen Berry Garden. So that project kind of came in. It wasn't part of the capital budget process, so we don't have dollars budgeted for it. So we're trying to identify what is the specific plan, how are the pieces are going to be donated, how much is being donated, and then we can do as much as we can this year. And then if there's anything that needs to be done that wasn't budgeted for, we can budget for it in capital budget. So please.
You mentioned Helen Berry, is that for the-
Oh, I'm sorry, you're right. Assisted, yeah. Thank you. It's not Helen Berry, it's the AL Garden. Thanks, Deb. Thank you. Yeah, it's the AL Garden. So we're working with them on that. So any questions or comments or other topics that people would like to cover? Please.
Do you have any updates on the data breach?
We've had one phone call so far, and it was what do I use this number for? So we've had no people reporting any issues, Debbie. Which Debbie's referring to is the robbery that took place, the burglary at New York Street. The police, there's no information. They check with the pawn shops in the area and so on. They look in the, what is that? Oh, no, I'm blanking, but it's that site that sells, people put it on a site and they sell it on a site. Now I can't remember. Craigslist, thank you. They check Craigslist, they check the pawn shops, it's not showing up anywhere. So it seems like they took those pieces and are probably breaking it down for parts, and they're not showing up being sold anywhere. But nobody's reporting any issues, thankfully, of issues of their information being compromised. So that's a good thing, thankfully. So,
And one other request.
sure.
Can you get a copy of the financial report?
Hey, didn't we send it? We'll get you here. I'll hand you mine. But yeah, yeah, we sent this to you guys, right? Yeah, should have been. It was an attachment to the agenda. Okay, so if anybody needs a hard copy, or let us know.
You guys use this big stuff and it uses up all my ink.
Oh, yeah, printing's a pain with this stuff, yeah. Any other comments, questions, other things you guys want to talk about? Okay. Anyone on the phone, anything? All right. Thank you all. Thank you. God bless. Be well.